My name is Lauri Kibby, and I am a board member at DAP Health. I think there's a misconception, or has been in the past. When I started doing my research about DAP Health, it was known as Desert AIDS Project. And there was this concept that it only was available to men and people who were suffering or with HIV. What I found out is that actually DAP Health, as it's now called, provided healthcare services to anybody who needed healthcare services. I found that quite inspiring. The rebranding of DAP Health takes us out of one lane and puts us in multiple lanes. It allows us to broaden our reach across the community. And our recent initiative, Hope Begins with Health, I think is a message for the entire Coachella Valley. So this rebranding allows us to fulfill on that promise of providing health care for everyone. Women have always been a passion for me, always. And there is a whole community of women throughout the entire Coachella Valley who are in need of the same services that the men and those with HIV in Palm Springs are in need of. They need help in finding support services. They need mental health support services. They need health care. They need dental care. And DAP provides all of that. And as a supporter of that initiative, I'm really excited that we will be able to provide services to women like LaWanda who have incredible stories. Being able to support the dignity of her and her journey is something that makes me really happy.
My name is LaWanda Manigo. I'm originally from Brooklyn, New York. I now reside out here in Desert Hot Springs, and I've been out here for about 7 years. When I came up into DAP Health, the support and the love and the community of not just women, also men, transgender, just the whole community was so welcoming and so loving and so supportive and so ready to help to see me succeed, which helped me to believe that I could succeed and helped me to feel like even though I may be by myself a lot of times, I'm never alone. It was through DAP Health that I was able to get connected with other women that are experiencing some of the same issues that I'm going through, and that were able to surround me with a community that I was able to discuss these issues with, and that I can feel safe and secure with to discuss these issues, because in the African American community, it still is rather taboo to discuss HIV and AIDS in our community. But I believe this is an issue that needs to be discussed more for our future generations, because I have a lot of nieces and nephews that are coming up that aren't experienced with some of the issues that I go through day to day. But I think it's very important that they become aware so that we can prevent the spread of this illness in the future. My message for future generations would be, do not let any illness or disease define you. You may be diagnosed with something, but that doesn't encumber all of who you are. As much as this has been a struggle for me, it has also been a blessing for me, because I've grown as a woman and just as a person, and just knowing who I am and where I stand in life and what my purpose is in life. My purpose in life is to let people know that HIV isn't the end of you. You can push forward and you can move on and you can elevate yourself through your illness. You can come to know who you are and the strength that you possess through what you have to overcome each and every day when you're dealing with this illness. As I look forward to the future, I don't really have a big mindset on what it would entail, but what I do know is that I'm not alone in it, because I have a community at DAP Health that's going to support me through it all, whatever may come.